Hello, I'm Dr. Michael Kessler. I'm here with Dr. Sandra Bicchetti, and we want to welcome you to the new site, The Brain Body Sync, which kind of tells it all, right?
Yep.
So here we go, Dr. Bicchetti.
We are practitioners in the field, designing technology for health professionals to improve outcomes. We are also distributors for the Neurovisor because of its importance in unsticking a stuck brain.
So we don't want to confuse you with all these headings and titles, but the Health Detectives is really myself and Dr. Bicchetti because we're still in the field treating patients, and we're the Health Detectives.
The HeartQuest Professional or the Neurovisor are not intended to replace the services and or the medical advice of a licensed healthcare practitioner, nor are they meant to encourage diagnosis or treatment of disease. This information is for research, education, and prevention. Any applications of suggestions set forth in the HeartQuest Professional or Neurovisor or this training are solely at the discretion and risk of the health provider. Implementation or experimentation with any supplements, herbs, dietary changes, medication and or lifestyle changes, including Neurovisor, etc., are done so at your own risk and responsibility. It is important that you work within the scope of your professional license and state laws.
Thank you again, Dr. Bicchetti, and here we go. So who the heck are we and what are we about, right? So that's our team. And I could start over here. I'm Dr. Michael Kessler, and there's Dr. Sandra Bicchetti. We've been in practice for about 40 years doing bioenergetic medicine, bioterrain analysis, functional medicine, and genetics. Anything else that we miss on that forefront? Probably there's other things, but
Yeah.
we are in the field, and we met Dr. Javdat Karamov probably, I don't know, 20 years ago, and we brought the first HRV system called the Dynamica from Russia to this country, and we used to teach it. And we translated it from Russian and taught many, many classes, right? And Dr. Karamov was an anesthesiologist from Russia, came here, got his NMD, and is still in practice too. So we have a living laboratory for health providers because we're testing everything out. We design health technology by health providers for health providers. Now, last but not least, we have Sean Hoover, the CTO, who's our tech guy, who's amazing. Guy's a genius and can figure anything out, and we're happy to have him. Anything else there, Dr. Bicchetti?
I don't think so.
Okay.
Yeah.
Oh no, there we are again. So here we are because we're also a distributor of the Neural Visor. This is the team that is the distributor for, and we call it what? Neural Wiser. Okay, it's Neural
Right.
Wiser. And this is not just any light and sound system. Okay, there's a lot of them out there, but this creates permanent neural plasticity in the brain because it's an active process. Some of these other light and sound systems are kind of passive, right? And so this one's active. It engages the brain to work and create new pathways. So there you go. So we have two amazing technologies, HeartQuest Professional and the Neurovisor. So we have to start here. And those who've heard me before, I kind of start here a lot because it's not the strongest of the species that survive, nor the most intelligent, but the one most responsive to change, Charles Darwin. And why? Well, those guys on the left there, those Neanderthals, they had an amazing ability to adapt. Otherwise, we probably wouldn't be here today. They had a strong autonomic nervous system to regulate all their body functions as needed and offset what? Droughts, ice ages, predators, and probably pathogens. And because of that ability to adapt, we are here today. So it's not balance that determines health. It's the ability to adapt and recover. That's a really important concept. So what we're talking about here is flexibility and adaptability if you want to be healthy. And we're not just talking about flexibility and adaptability in the autonomic nervous system, but we're talking about that in the brain. The brain networks have to talk to each other, otherwise we're going to have cognitive issues and a lot of other brain type issues, right? The immune system has to be flexible and adaptable as well. Or we have autoimmune problems and we can't dance back and forth between the different components of the adaptive and innate immune system, we're going to have problems. So health has to do with the top, flexibility, adaptability, and when we're not healthy, it has more to do with being rigid and stuck. Does that make sense?
Yes.
Okay. So in this slide, we're talking again about adaptability versus just balance.
The problem is not stress. It is the inability to adapt to it. Ability to respond to stress, ability to recover efficiently, ability to shift states and go from the sympathetic to the parasympathetic and back and forth as needed. The HeartQuest measures adaptability of the autonomic nervous system.
There you go. And when we're talking about this, what's really important is HeartQuest Professional detects loss of adaptability before functional breakdown occurs. It's your best prevention, really. And so what identify is down below where the checks are. It says identify autonomic dysfunction early, track the loss of adaptive capacity, guided, focused, proactive care, because from that, you're able to see where the person needs support. So we're measuring changes before the patterns become chronic. That's really, really important.
So when you've measured already in the heart rate variability, now it's time to synchronize the brain and the body. And this is where we come together with the neurovisor. The HeartQuest will track the change, and the neurovisor will train the change.
Yeah, that's just a great combination. It really is. So we have why a practitioner should purchase a HeartQuest Professional. Now, a lot of you have it already, but some of you out there have not. And these are some of the things that are listed here that are really important. Did you want to read some of those, Dr. Piketty?
Sure, because the HeartQuest measures what your hands cannot. It provides instant and objective data. It tracks the autonomic nervous system changes. It identifies stress overload and compensation. It guides and validates your therapies. It provides efficacy to skeptical patients. It produces quantifiable outcomes. It's easier to use than you think. It generates clinical progress charts. It builds credibility for patients and referrals. It transforms you from a practitioner to a clinical authority.
That's pretty important. That's a lot of good things that
Absolutely.
device does, right?
Yeah.
And here again, why a practitioner uses Neurovisor in the first place.
Well, the neurovisor directly influences the autonomic nervous system. It improves vagal tone, or the HF or high frequency in the HeartQuest Professional, which equals recovery. It reduces central stress load, which is the very low frequency, and the HPA axis. It helps shift patients out of sympathetic dominance, hugely important. Accelerates recovery between stress events. Enhances neuroplasticity or brain rewiring. This is also huge. Supports regulation at the brainstem level. The NTS, which is
the nucleus tractus alterius. It's easy to forget that.
Thank you.
And just to stop right there, you're going to find that you're going to save some lives by working with this particular system because it's in control of blood pressure regulation. And we're going to talk and do a whole module on that next.
Yeah.
Okay. And the other one thing that I like to mention is you don't know yet if you don't have HeartQuest, but that VLF, number 2, that's huge. And we find that the VLF is elevated, increased. And that's your HPA axis that's producing all that cortisol in a chronic stress condition. But it also has a lot to do with the deep emotional component, which we see in the limbic system, where we store that deep emotional information that can be affecting people, causing anxiety and PTSD. So let's go ahead and continue. Where do we leave off?
Well, it also improves outcomes when you're using other therapies. And it provides a non-invasive but a very active way to train the nervous system. It gives the practitioner a way to actively change their physiology via the brain.
Yeah, exactly.
This is not passive therapy. This is active autonomic nervous system training.
This is what makes this different from the other systems that are out there.
Yeah.
And very, very powerful. And we suggest, because we work with patients and we have them take this home so they can actively use the neurovisor to make those changes every day, other than just doing it in the office.
Yeah, it's important that they are consistent
and proactive,
Yeah.
right?
So, what's the difference? Relaxation versus neurological training. Well, with relaxation, it's a passive input, it's just a temporary state change, and it can be helpful in some instances. However, for neurological training that the neurovisor does, it's active engagement. You get adaptive change that becomes
Permanent.
a permanent part of their brain. Relaxation, again, is not the same as retraining the nervous system. One changes how you feel temporarily, the other changes how your system functions.
And how it's wired.
That's important.
So what happens when you combine HQP plus neurovisor? Well, it's such a great combination because you're able to see how stressed that person is and what their state is when you do the HQP, when you perform that to assess. And then right away, you'll know which neurovisor programs to use to improve brain function. I think that pretty much says it, right?
So the HeartQuest professional also looks at Western and Eastern parameters. This is a science that connects Western and Eastern philosophies and education. In the Western medicine parameters, we use a 5-minute EKG to assess cardiac function, vascular regulation, and the autonomic balance.
Yeah. So can I just intervene on that one a little bit? So Dr. Piketty got it right because we're going to do an EKG. From the EKG, we're going to measure heart rate variability. From that, we're going to break that signal down into its individual frequency band components that give us information about specific physiology. And that information we can use to tell us about Chinese medicine and Ayurvedic medicine very accurately. So you can look at the whole picture. Right? So also, what it says down below, it measures cardiac, vascular, and whole body balance. Well, you're going to get into the cardiovascular section because we talked about that, and there's some signs in this autonomic nervous system reading, this HeartQuest professional, that tells us about cardiovascular risk and that you can start to do something about it early on.
Absolutely. So we can enhance bioenergetic practices with an objective feedback tool like the HeartQuest Professional. For the energetic practitioner, you get an assessment, you get a pattern recognition, and clinical experience. But with objective feedback, you get an actual objective measurement. You get insight into the autonomic nervous system, and you get real-time feedback.
Yeah. So a lot of, we also have a lot of technology here that is bioenergetic, like that device on the left. And those are amazing technologies. But if you run somebody and you get all this data, 10 seconds later, you run it again, and it's different. Okay, so we want something that's consistent, objective. So when you're doing bioenergetic medicine, whether you're putting into the body scalar waves or you're giving them imprinted information from those devices, those are fantastic. But you want to show that it's actually making changes to your patient, right?
Yes. And the HeartQuest Professional will confirm these changes. And it also is saying that you can measure the differences.
Perfect.
In what you feel.
Exactly. So we're not going to get into this right now because we're going to do a series of webinars. But when you measure it, you can change it. So if you don't know what you're looking at, it's hard to know what you did.
Right.
Right. So there we go. So
the HeartQuest Professional is a 5-minute test. It's so easy that a child could run it.
Yeah.
Just 5 minutes.
That's all we need. That's it.
Yep.
Yeah, it's that simple.
This is where the HeartQuest Professional changes everything. Without it, you're looking at single parameters, missing compensation patterns, late detection of breakdown, treating symptoms, not a system. That's reactive care and not a holistic approach.
So with HQP, the full system interpretation, frequency, which we will talk about in the next section, plus time domain integration, those are the two components that make up heart rate variability, you get early detection of instability, clear clinical direction, really, which way you're going to move that patient. So it's proactive precision care.
So you're no longer guessing, you're seeing the system in real time. Earlier detection leads to better decisions, better outcomes, and changes lives. So we can save lives by seeing this early. The silent progression that we don't always notice, arterial stiffness, early wave reflection, what has to do with the blood flow from the heart, higher pulse pressure, which is indicative of arterial stiffness, higher cardiac workload, and reduced coronary perfusion.
So one of the sections, which will be right after this, which will be on the same website, I'm going to do a program for you on how this will help you to save lives and what you need to do, what you need to look at in the HeartQuest with something called pulse pressure, where you measure the blood pressure. It's the difference between systolic and diastolic, but mixed with some of the parameters from HeartQuest Professional, you're going to be able to see that some of our patients have stiff arteries and what that does to the heart, where it has to work so much harder, and it's a big cardiovascular risk factor. Early detection, huge. Elastic arteries, normal wave timing. That means as the wave, when the heart beats, it sends out a pulse wave through the body and it returns back. But if the arteries are like a pipe, it comes back too fast when the heart's trying to make its next contraction. So it's working against itself. And that's definitely, and we can talk more about that, that's definitely a big cardiovascular risk. So we want a lower cardiac load, better coronary perfusion, and improve recovery. And we'll tell you what to do about that.
And we know just from the standard models out there that most patients are compensating long before symptoms appear.
Perfect.
So in the traditional model, like we just mentioned, we wait for symptoms. We get a late diagnosis, and then we treat the disease at that point. We react. It's reactive care, reacting to their symptoms, and we miss any early dysfunction that could have prevented this from happening.
Yeah, absolutely. So the HQP model, detect dysfunction early, see compensation patterns, measure autonomic nervous system, and intervene before disease. Proactive precision care. This is what we're about in integrative medicine, is prevention.
Yes, we're not waiting for disease to happen. You're identifying dysfunction in real time.
So we're not going to go into depth here, but this is what we're kind of looking at. And these are some of the parameters that we're looking at when we look at the HeartQuest Professional. Do you need me to say anything in here, or should I? I could tell them a little bit. The very low frequency. This is still part of mainstream medicine's attempt at frequency medicine, really, and it's the very low frequency range has a lot to do with the central nervous system, and it has a lot to do with the HPA axis, which is sensing stress and putting out its hormones, right? Corticotrophic releasing hormone and all those, all the way down to the adrenal glands, where the adrenal glands is going to produce cortisol in response to stress. But this particular VLF is what we find in mostly chronic conditions, and those are the people that we see who have big time issues, right? And inflammation and other things going on. So that's the VLF. And the LF, we're going to see in the next episode how it's involved with cardiovascular issues and regulating the baroreflex regulation for controlling blood pressure. We'll talk about that. HF is where we regenerate and recover, and that's where the vagus nerve is, which is the all-important vagus nerve that is we all talk about, that's so important in regulation of our digestive system and the gut-brain connection and reducing major cytokine inflammation. It's a connection between the immune system and the nervous system. So HQP shows you what the system is doing, why it is doing it, whether it can recover.
So we offer world-class education for health professionals. We have advanced neurovisor training and advanced HeartQuest professional training. We have training and support at a higher level. Brain training with the light and sound device that changes the brain. Personalized protocols in clinic applications, automated for you. And we have heart rate variability analysis interpretation on a much higher level in the autonomic nervous system, of course, and how to manage different outcomes.
Yeah, the education is really vital and important, and we take it pretty seriously. And I would encourage you to watch the videos. And we try and make them as short as possible, but sometimes they get a little carried away. But watch them, please.
So we have some special pricing too. The regular price for the HeartQuest Professional is $3,975 per device, and the NeuroVisor for a single device is $485 for one device. But we have a bundle price where you can get both one HeartQuest Professional and one NeuroVisor for $4,210, and you get a $250 savings with that price. Online education included, and there's no shipping charge with that. If you want to purchase multiple NeuroVisor devices, they're at $435 each, and you can call us anytime, and we will talk to you about how you can get one. And there are also plans where you can pay a little bit a month for them, and so there's no burden to purchase any of them.
That's
and you're
perfect.
going to help a lot of people.
Well, there you go. So I want to thank you again for listening today, and we hope to see you in the next episode, and we hope to encourage you to use this in your practice.